In this video lecture, we'll review the prevalence of trauma exposure as well as trauma and stressor-related disorders and discuss the course of post-traumatic stress disorder. We'll start by talking about the prevalence of trauma exposure among adults in the United States. The data I'm going to show you comes from the National Comorbidity Survey, and I'm going to show you data for men and women separately because, as you'll see, patterns of trauma exposure differ between men and women. In general, the majority of adults in the United States, so about 56%, report having experienced at least one event in their lifetime that would meet criteria for being a Criterion A trauma according to DSM-5 criteria. Among men, 61% report having experienced at least one traumatic event, and among women, 51.2% report having experienced at least one traumatic event. For both men and women, the most common traumas that they report experiencing are being involved in an accident, for example, a serious motor vehicle accident, experiencing a natural disaster or fire, being threatened with a weapon, or witnessing another individual experience a life-threatening or dangerous event. For women, another significant trauma exposure is sexual assault. When we consider the prevalence of trauma and stressor-related disorders, it can be challenging to investigate the prevalence because of the different ways in which these disorders have been measured across various studies, and also because these disorders are also not commonly measured in large-scale epidemiological studies. One exception is post-traumatic stress disorder. We do have data from the National Comorbidity Survey replication about both the lifetime and 12-month prevalence of post-traumatic stress disorder. This suggests that about 6.8% of individuals meet full criteria for PTSD at some point in their lifetime, compared to about 3.5% of individuals who meet criteria within the past year. So you'll see that there's a significant discrepancy between the proportion of individuals who have been exposed to a Criterion A traumatic event compared to the proportion who develop PTSD. So this suggests that the majority of individuals who experience potentially traumatic events do not go on to develop PTSD. This is corroborated by evidence from studies looking at the prevalence of acute stress disorder. Acute stress disorder is typically not included in large-scale epidemiological studies, so most of the data that we have regarding its prevalence is from studies assessing the prevalence of acute stress disorder following specific kinds of traumatic exposures. From these studies, we know that the prevalence of acute stress disorder varies depending on trauma type, but overall, estimates suggest that between 5 and 20% of individuals will meet criteria for acute stress disorder within the month following a trauma exposure. Adjustment disorder has also not been assessed in many epidemiological studies. However, in one large-scale epidemiological study focusing on depression and mood disorders, the 12-month prevalence of adjustment disorder was found to be approximately 1%. We do see higher prevalence of adjustment disorders when we look in treatment-seeking populations, so among individuals who are experiencing distress and who are seeking care from either a medical provider or a mental health care provider, we see higher prevalence of adjustment disorders. We know that there are characteristics of both trauma exposure and of individuals that are associated with increased risk that an individual will go on to develop post-traumatic stress disorder. When we consider characteristics of the trauma that are associated with increased risk for PTSD, some specific types of trauma are associated with an increased risk for developing PTSD symptoms. These include sexual assault, physical assault, and combat exposures. We also know that characteristics of individuals' exposure to the trauma, so for example, their proximity to the trauma. For example, an individual who experiences an earthquake will be more likely to develop PTSD the closer that they are to the epicenter of the earthquake and the most severe damage at the time that the earthquake occurs. This is also related to the severity of the trauma. So individuals who experience events that are more severe are more likely to develop PTSD, or individuals whose own experience with the trauma, so for example, in a natural disaster, individuals who are personally more strongly affected and experience more negative consequences related to the event. We also know that duration is associated with increased risk for PTSD. So the longer an individual is exposed to a trauma, or if an individual is exposed to chronic traumas or repeated traumas, they have a greater likelihood of developing PTSD symptoms. We also know that characteristics of an individual's response to the trauma exposure can help predict symptoms of PTSD. So one thing that we know is that individuals who experience dissociation during or immediately following exposure to the traumatic event appear to be at increased risk for developing symptoms of PTSD. We can also consider demographic characteristics of individuals that are associated with differential risk for PTSD. Similar to our other anxiety disorders, we see that women are at increased risk for PTSD compared to men. This is interesting because women have a lower risk for trauma exposure, but even taking that into account, women have a higher risk of developing post-traumatic stress disorder. We see differences across countries and across regions of the world. However, it's difficult to interpret these different findings because of different ways that the disorder is defined and operationalized in different studies, particularly because the criteria for PTSD have changed across various versions of the DSM. One thing that is clear is that the likelihood that individuals within a country or region will develop PTSD is often related to situational and historic factors. So for example, currently we see some of the highest rates of post-traumatic stress disorder in South Africa and Northern Ireland, which are both countries that have experienced significant historic events in which individuals in those countries have been exposed to violence or other potentially traumatic experiences. Within the United States, we see a higher prevalence of PTSD among African Americans and Hispanic Americans compared to European Americans. And we also know that individuals in certain occupations are at increased risk for both trauma exposure and for developing symptoms of PTSD. These include veterans and individuals who are currently in the military, and also include first responders. The course of PTSD can be highly variable. So as I mentioned earlier, somewhere between 5 and 20% of individuals will meet criteria for acute stress disorder following exposure to a trauma. Many of those individuals will subsequently go on to meet criteria for post-traumatic stress disorder. The estimates vary across different studies, with estimates somewhere between 40 and 80%. In a review of these studies, the average was 70%, but again, there was wide variability in the proportion of individuals with acute stress disorder who went on to meet full criteria for PTSD. The onset of post-traumatic stress disorder typically occurs within 3 months of trauma exposure, but interestingly, at least a third of individuals who go on to meet criteria for post-traumatic stress disorder do not meet criteria for acute stress disorder within the first month following the trauma exposure. So even though many individuals with acute stress disorder do go on to develop PTSD, we also need to consider individuals who do not meet criteria for acute stress disorder as still being at risk for subsequently developing post-traumatic stress disorder. Approximately 50% of individuals who meet criteria for post-traumatic stress disorder will experience recovery within 6 months of developing the disorder, even without intervention. However, there is a significant proportion of individuals who experience what is called in the DSM post-traumatic stress disorder with delayed expression. So this specifier refers to individuals who do not meet full criteria for PTSD until 6 months or longer following the trauma exposure. Some of these individuals are experiencing subclinical symptoms of PTSD within 6 months following the trauma exposure, but some of these individuals do not experience symptoms during these 6 months and may not, in fact, develop symptoms of PTSD until well after the trauma exposure has occurred. And the long-term course of PTSD can be highly variable. For a long time, people thought that the characteristic trajectory of post-traumatic stress disorder was that individuals develop symptoms shortly after the trauma exposure, if they were going to develop them at all, and that they had their most severe symptoms early in the course of the disorder and would then experience a resolution of symptoms over time with or without intervention. We now know that there are various patterns that characterize the ways that individuals respond to traumas. Some individuals never develop symptoms of acute stress disorder or PTSD. Some individuals develop symptoms of acute stress disorder in the immediate aftermath of the trauma, but these symptoms resolve relatively quickly and they do not meet criteria for PTSD. Some individuals meet criteria for acute stress disorder and continue to have symptoms of PTSD, but their symptoms resolve over time, often within 6 months. But we also see a group of individuals who tend to have chronic symptoms, and their symptoms may fluctuate over time. So their symptoms may increase, particularly in the context of increased stressors or external events, particularly those that might be related to their traumatic event exposure. So when it comes to the course of the disorder, we see a highly variable course, with some individuals developing symptoms significantly after the initial trauma exposure, and individuals also sometimes continuing to experience severe symptoms or impairment for years and years following exposure to the traumatic event.